I feel like these conversations usually open a can of worms. Should PAs be able to practice autonomously? Having gone through both PA school and working as a PA and now medical school, I would not want to work autonomously as a PA. Yes, you have a very good education. You do get a lot of clinical information through your didactic year and your clinical year. However, you don't know what you don't know. And that is still true even as an attending. There are so many things that can go wrong with a pediatric patient that you can't even fathom or know about unless you see it, which is why we do residency and all the specific education and training to become a pediatrician. Same goes with every other field in medicine. There is a reason for the residency, for the long hours to see more patients, the standardized education you get for years after medical school, and then even more years if you do a fellowship. Yes, you can learn a ton clinically when you are working as a PA out in the field, starting your job. There are tons of things you will learn. But there are also so many nuances and other little things that you really don't get to know about unless you have someone either teaching you regularly or you see it for yourself and then someone explains with you like how to manage it or why it's happening. So yes, clinically you can function, especially in there's certain fields where you're more trained, so like you get a ton of internal medicine as a PA. So yeah, you can be an outpatient PA and manage everything on your own. But there's just sometimes those cases, those things that I feel like having an attending or someone supervising you to bounce ideas off of, to discuss with you, is essential. And just seeing and knowing what I know, I don't think it's worth it as a PA to be put in a situation where you may not know something because you haven't seen it before or didn't get that exposure, and putting a patient's health and safety at risk, to me, just isn't worth it.